Botox, onabotulinum toxin A. What you want to know about Botox treatment for overactive bladder, OAB. How well does Botox work? Thinking about trying Botox treatment for your OAB? First, think about how OAB is affecting your daily life. For example, there's the annoyance of having to limit your activities and plan your day around bathroom breaks, finding bathrooms, and avoiding drinking too much liquid. Then there's the embarrassment or worry that other people might notice your symptoms. And finally, you may experience frustration because OAB can limit you and impact everyday decisions, like what you can wear and where you can go, as well as how you feel about yourself in general. The good news is, in clinical studies, patients using Botox completed a questionnaire about overall quality of life and reported that they noticed an improvement in all three of these categories. Next, take a minute to think about how many leakage episodes you have on a daily basis. Now, think about this. In 3 clinical studies, patients receiving Botox for OAB reported a significant reduction in their daily leakage episodes at week 12, compared with patients who did not receive Botox treatment. At week 12, many of these patients saw their daily leakage episodes reduced by half or more following Botox treatment. In fact, the majority of patients receiving Botox had at least a 50% reduction of daily leakage episodes. And that's not all. Most of those patients reduced their leakage episodes by 75%. What's more, approximately 1 in 4 participants reported their leakage episodes stopped completely during that time period. Still wondering if Botox can improve your overall quality of life and OAB symptoms of leakage, the strong sudden need to go and go in too often? Stop wondering. Just one more reason why you should talk to your doctor to see if Botox could be right for you. Up next, how does Botox work? How does Botox work? To understand how Botox works to treat overactive bladder, first it helps to know how your bladder works. In your body, certain chemicals travel from nerve cells to muscle cells to make your bladder contract so that you can urinate. When you have OAB, these muscles contract uncontrollably, creating leakage, the strong sudden urge to go to the bathroom, or the need to go to the bathroom 8 or more times a day. Botox is different from other treatments you may have tried because it takes another approach to target the source of your OAB, the bladder muscle itself. Botox works by calming the nerves to help block the signals that trigger OAB. If you and your doctor decide that Botox is right for you, very often the treatment can be done right in your doctor's office. You're probably wondering what the actual treatment process is like. Prior to the day of treatment, you will be given an antibiotic to reduce your chances of a urinary tract infection. You should not be given Botox if you have a urinary tract infection. On the treatment day, your doctor will fill your bladder with a numbing agent to increase your comfort during treatment. Your doctor may also offer a sedative to help keep you relaxed and comfortable. The procedure itself is quick. Once your bladder is numb, your doctor will insert a cystoscope through your urethra, the natural opening where the urine comes out. A cystoscopy is a common in-office procedure that you may have already experienced when your doctor determined the cause of your bladder issues. Botox is given through the cystoscope through a series of quick injections into specific areas of your bladder muscle. The prep time in treatment takes approximately 30 minutes, with the injections usually taking 15 minutes or less. After the procedure, your doctor will want you to stay in the office for about 30 more minutes to make sure you can easily empty your bladder before you go home. You should not experience significant pain after treatment, although it may sting or burn when you urinate the first few times. You may also see some blood in the urine right after treatment. The most common side effects of Botox reported in the first 12 weeks of treatment were urinary tract infection, painful or difficult urination, and the inability to fully empty your bladder. See your doctor if any of these symptoms persist. Your doctor may ask you to pay attention to how easily you can go to the bathroom. Your doctor will want to know if you experience any trouble urinating after the treatment. Some patients may need to temporarily use a self-catheter to help fully empty their bladder. However, it's important to know that 93.5% of patients in the clinical trials did not have this side effect. That means only 6.5% of patients treated with Botox needed to use a catheter following their treatment. Unlike the type of catheter typically used in hospitals, this is a very small disposable catheter about the size of a thin straw or coffee stirrer that can easily fit in a handbag and can be used in any restroom as needed. You can learn more about the possible side effects at BotoxForOAB.com and speak with your doctor about any concerns you may have. Up next, how long does one Botox treatment last? How long does one Botox treatment last? Botox is a different way to manage your ongoing OAB symptoms. It is not a daily treatment. Although everyone's response is a little different, OAB symptoms can be adequately managed with as few as just 2 Botox treatments a year. You may begin to experience reduced daily leakage episodes as soon as 2 weeks after treatment. You should begin to experience fewer leakage episodes as Botox begins to work. In clinical trials, Botox provided up to 6 months of OAB symptom improvement. You'll need to consult with your doctor to review the results of your treatment cycle and schedule retreatment about every 6 months. Keep track of how you are feeling or keep a bladder diary to help you remember how you felt before you started treatment so you can monitor how well Botox is working. It's important to be proactive and schedule an appointment for retreatment about every 6 months. You can always reschedule if your symptoms return sooner. Keep track of when your symptoms return. Always wait at least 3 months in between treatments. Just imagine, you may be able to manage your OAB symptoms with as few as 2 Botox treatments per year. Just one more reason why you should talk to your doctor to see if Botox could be right for you. Up next, treatment considerations, Botox safety information.
Botox, onabotulinum toxin A, important information. Indication: Botox is a prescription medicine that is injected into the bladder muscle and used to treat overactive bladder symptoms, such as a strong need to urinate with leaking or wetting accidents, going too often, and the strong sudden need to go in adults 18 years and older when another type of medication, anticholinergic, does not work well enough or cannot be taken. Important safety information: Botox may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks after injection of Botox. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms, including loss of strength and all-over muscle weakness, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, and trouble swallowing. Botox may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Do not receive Botox if you are allergic to any of the ingredients in Botox. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myobloc, ribebotulinum toxin B, Dysport, obobotulinum toxin A, or Xeomin, incobotulinum toxin A. Have a skin infection at the planned injection site. Do not receive Botox for the treatment of urinary incontinence if you have a urinary tract infection, UTI, or cannot empty your bladder on your own and are not routinely catheterizing. Due to the risk of urinary retention, difficulty fully emptying the bladder, only patients who are willing and able to initiate self-catheterization post-treatment, if required, should be considered for treatment. In clinical trials, 36 of the 552 patients had to self-catheterize for urinary retention following treatment with Botox, compared to 2 of the 542 treated with placebo. Patients with diabetes mellitus treated with Botox were more likely to develop urinary retention than non-diabetics. The dose of Botox is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported, including itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you experience symptoms. Further injection of Botox should be discontinued. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox. Tell your doctor about all your medical conditions, including if you have or have had bleeding problems, have plans to have surgery, had surgery on your face, weakness of forehead muscles, trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, have symptoms of a urinary tract infection, UTI, and are being treated for urinary incontinence. Symptoms of a urinary tract infection may include pain or burning with urination, frequent urination, or fever. Have problems emptying your bladder on your own and are being treated for urinary incontinence. Are pregnant or plan to become pregnant. It is not known if Botox can harm your unborn baby. Are breastfeeding or plan to. It is not known if Botox passes into breast milk. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Using Botox with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myablock, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received. Have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take aspirin-like products or blood thinners. Other side effects of Botox include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, dry eyes, drooping eyebrows, and upper respiratory tract infection. In people being treated for urinary incontinence, other side effects include urinary tract infection, painful urination, and/or inability to empty your bladder on your own. If you have difficulty fully emptying your bladder after receiving Botox, you may need to use disposable self-catheters to empty your bladder up to a few times each day until your bladder is able to start emptying again. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see Botox full product information